So we're looking at the theory and practice of hydrotherapy. This is part 4 of our series here that we've been doing. And just a reminder that anytime you encounter new therapy or modality or idea that seems like it might work for you, make sure you do your own due diligence to make sure that that is what is going to work best for you, and that it is a sound practice. Back in 1903, Thomas Edison is quoted as saying, "The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and the cause and prevention of disease," which was a forward-thinking statement at the time. And he may have gotten it from someone else who actually spoke earlier of a similar nature in 1885. Ellen White in Testimonies for the Church stated that there's only one way that heaven approves with regard to the practicing of the healing art. And basically that's just using the things that God has given in nature. Pure air, water, cleanliness, a proper diet, purity of life, and a firm trust in God. But they take skill to appreciate those things. And we need to make sure that we take care of our soul so that we can prosper in all things, be in health and other areas of prosperity. And remember that we're a living sacrifice, that it's our reasonable service that we present ourselves that way, a living sacrifice, and that we can be conformed. Do not be conformed to this world, but be transformed by the renewing of your mind. So that's important to remember those concepts as we go through each day. So today we're going to look at some additional cautions and rationale for those cautions within the practice of hydrotherapy. The first thing is that we need to make sure that we keep the feet warm, unless you're treating the feet directly, like putting in a hot foot bath. And a hot foot bath, of course, is going to be warm, or treating like something that we would be doing a contrast to remove the congestion or improve the circulation in the feet. We really need to keep their feet warm if you're doing a treatment in another part of the body. If there's any kind of a heart issue, you want to make sure that as you're doing a heat treatment, that you keep a cold pack over the heart area. That's going to help them be able to facilitate the hydrotherapy treatment more safely. Make sure that you cool the forehead and the back of the neck during warm treatments. This is particularly true in things like the hot foot bath, where you wrap them up with a sheet and a blanket, and essentially they're going to start perspiring. Body temperature is going to increase, and so you want to make sure that you keep that temperature down. You can also include drinking ice water with that periodically through that treatment. Also, you want to make sure that you don't overdo the hydrotherapy, because hydrotherapy done in excess for a prolonged period of time, or with prolonged treatment of colder or warm can create a hydrotherapy headache. So post-treatment, individuals should be quickly dried and kept warm and comfortable. We're going to look a little bit at what hydrotherapy is and what comprises hydrotherapy headache. So hydrotherapy headache can come with excessively long applications of hydrotherapy. So generally speaking, 3 cycles is what you would consider a normal treatment. So hot, cold, hot, cold, hot, cold, and then you're done. Or a 20 to 30 minute treatment, where you would, like, for example, the hot foot bath, that would be 20 to 30 minutes max on that. So that's the general time frame. And 3 cycles of like a hot and cold shower, that's not going to take that long to do, and other hot contrast kind of things. So if you're doing that for more than that, you're going to be wearing out the body's ability to react or respond to the hydrotherapy, and that can cause a hydrotherapy headache. Secondarily, an incomplete or excessive reaction. So if there's not enough reaction, or if it overreacts, there's excessive flushing or shivering immediately with a cold therapy, that can cause a hydrotherapy headache. Not enough rest period following treatment, the minimum of 30 minutes of rest. So when they get done with their treatment, they should find a nice warm area. It's not drafty. and lie down or rest for at least 30 minutes before getting up and doing anything else. If you just jump up right after your hydrotherapy treatment and go and do something, you're going to possibly negate the effects of the hydrotherapy, the positive benefits, and it also may result in this hydrotherapy headache. The fourth thing is not using a cold forehead or neck compress during the therapy. We talked about that already. So whenever body temperature, that's T sub B in scientific jargon, reaches or exceeds 100, you want to make sure that at that point you're using a cool washcloth to sponge the head and neck. You can use cold ice water with a straw to help internally cool. And you can just make sure that you keep track of the body temperature with any type of measuring device. Probably the most efficient would be one of these readers, like the lower left there. Just can do a quick scan. These have kind of become more popular in the last little while. The oral thermometers would be a little bit cumbersome, but certainly would work fine too. So monitor the body temperature and make sure you keep them cool enough during that period of time. So no one likes a headache. And there are ways to work with that. You know, even hydrotherapy can be used to benefit a headache too, if it's a congestion-based headache or like a migraine or something like that. So in a short kind of a therapeutic way, but this is a headache that is resulting from an excessive use of hydrotherapy. So some other hydrotherapy cautions. When you're using low temperature treatments like very cold water, you want to do that for just a short duration. So you're going to be using ice in the water, for example, or an ice rub or something like that, 1 to 5 seconds for very cold treatments. So there's going to be that's the cold end of the spectrum. So warm or neutral treatments, you can pretty much do those infinitely. So sometimes there were some mental patients that were referred to that were used that they weren't used, but they used hydrotherapy in a neutral setting for like a month at a time. Basically, you want to make sure that you keep it at least body temperature, so you're not going to be chilling. You don't want hydrotherapy to ensue. Of course, you don't want body temperature to be elevated above and beyond normal in excess either. So typically, you're going to be 30 minutes to 1 to 2 hours would be the maximum typically for a neutral, even though you could go much longer, because a neutral treatment isn't going to be changing your body temperature much. Got an extra L there on typical. So the seventh is very hot treatments. You're going to also be doing short duration, so rarely more than a minute. So that's very hot. So a hot foot bath, that's not very hot. That's just very warm. Very hot. It's not neutral. So there's a gradation of scale on both ends of the spectrum. So for reducing fevers, the cold treatments for that without percussion. So remember that percussion or friction actually increases or synergizes the cold treatment. You can do that for 15 to 20 minutes as necessary. So the percussion actually accelerates or increases the reaction associated with that. So basically the principle is very cold and very hot. You can be short treatments. Neutral can be nearly infinite. And in between, if you're just tepid or cold, no ice, you can do it for a longer period of time. And likewise for very hot or very warm, you can do it for longer. So there's kind of a scale in there that just need to pay attention to as far as duration of treatment. So remember that very low temperature, like with ice water or ice, very short, very hot, very short. Not only that, just therapeutically, but it is uncomfortable for the patient as well. So attempt to train the person to progressively react to the coldest treatments. So they're going to be responding well to it. And sometimes it takes some physiological training. So the best and longest lasting are the short cold treatments that can be repeated frequently. So they can be repeated, every several hours through the day if necessary, depending on what the application and the purpose is. So prolonged cold treatments are rarely helpful. So keeping it in ice water or other prolonged cold, there is an endpoint. So for example, I guess hydrotherapy would be what you would use when you run your finger under cold water when you get burned, right? So basically the first thing you're doing is trying to reduce the temperature of the tissue and make sure that it doesn't continue burning wherever that burning happens to be. But then after a period of time, it's going to become numb, and then you have maximized the benefit of the cold, other than the numbing, maybe reducing the pain for a bit. So exercising post-cold treatment can be a very excellent warming activity, but depending on the individual, that may not be a practical extension, but it's a good way to help the person warm up post-cold treatment, as opposed to post-warm treatment. Just a light exercise. So warm treatment you're going to usually follow with a rest. So gentle exercise, not something that you're going to be doing in an aggressive way. So generally, when you're doing alternating therapies, alternating contrast, you're going to end up with a rest. But if you're doing just a cold treatment on its own, some mild form of exercise could be helpful. So in situations that people find themselves, hydrotherapy may not be beneficial. So just be careful as you're attempting to use hydrotherapy and use elements. So someone who's anemic, essentially that's iron poor blood, and the hydrotherapy isn't going to really address the underlying cause. So basically they have a low oxygen carrying capacity of the blood because of the low iron. Someone who's very thin, so they're going to may respond very quickly to the treatments just because they have less body mass to impede it. Someone who's overly feeble, that could be not beneficial. Someone who's neurasthenic, so that's someone who has lassitude or fatigue, headache. Basically, it's an emotionally disturbed kind of response. So that's not going to really help that too much, probably. Alcoholics tend to not respond super well to, especially if they're inebriated. Someone who's sleep deprived, either from exhaustion or hysterical, only short cold treatment should be used to someone who's sleep deprived. So it'd be better to get them onto a sleep situation where they can get adequate sleep before starting hydrotherapy. Neuralgia. So neuralgia is where there's a pain in a nerve pathway. So you can see the person here in this face along the trigeminal nerve. It spreads out across the face. Lots of different nerve pathways that can have this occur. So like shingles, for example, would be chickenpox, varicella in the nerve that causes shingle that follows a nerve pathway. So hydrotherapy may not be beneficial in that type of situation, as well as muscle pain in general, myalgia. So there's fibromyalgia and there's other types of myalgia. So muscle pain in general, hot and cold treatments can be helpful, but so just it may not be beneficial. Also painful congestion, chronic rheumatism. So I have rheumatoid arthritis here, which is different than rheumatism, but there's still joint-based pain and joint pain that could be from rheumatism. So painful neuritis, so that's inflammation of the nerve. Cold is often not tolerated very well at all. So individuals who can receive short cold treatment should first be warmed. So remember, hot before cold. Make sure that they're warmed not significantly, but adequately, so they're not starting out getting a cold treatment when they're already cold. That's really a critical part when thinking of using a cold treatment. Also, people who are hypochondriac tendency, those are people who think they're sick all the time from this or that and the other thing, or people who are timid or sensitive. Just make sure that as you're going into that kind of a therapeutic modality that you always explain your procedure before you do the next step, so they know what's happening and they understand what's happening each step of the way. And it's better to go slow than to rush. And you can't really rush hydrotherapy anyway. And that's one of the beautiful things about being able to do hydrotherapy, is it gives you an opportunity to converse kindly with your individual, and perhaps open themes of discussion that one might not be able to approach in other types of treatment modalities that can relate to our maker and our creator and his love for us. So cases where mild cold only are used in combination with with water as treatment. So weak heart, Bright's disease, that's essentially inflammation of the nephron. So the nephron is in the Bright's disease diagram there in the middle that's been blown up. There's the capillary and the glomerulus, and then there's ascending and descending tubules, and those are what make up the nephron. And essentially, that's where the blood gets filtered in our body. Sometimes there's blood that can be in there, or protein excessively, or red blood cell casts that are indicators of that. Diabetes, mild cold only, heart disease, other types of kidney diseases in children less than 7 years. So you don't want to use ice water or very, very cold treatments in children less than 7 years with these other conditions. Avoid cold baths during a woman's period, during pregnancy, and particularly in old age with people that are suffering from arteriosclerosis. Sclerosis is hardening of the arteries. Essentially, they lose their flexibility and their ability to vasodilate and vasoconstrict efficiently and effectively. So just need to be gentle with that, and probably start with a dietary intervention that would help to unclog the arteries. Weak heart, emphysema essentially is and bronchitis or lung conditions and respiratory conditions that also have blood delivery and movement issues. Aortic aneurysm, someone who may have had an aortic aneurysm, you don't want to be using excessive treatments, cold or hot, mild cold, advanced arteriosclerosis, and someone who may be stroke prone or have a tendency towards stroke. So someone who has had a stroke is going to be more prone for another one, potentially. So that's once you've had a stroke, that basically sets the stage for potential additional ones down the road. So it's just something to be aware of and take care of. So avoid very hot treatments for people who have cardiac disease. Again, that tends to increase metabolism, increase vasodilation and blood movement. And it's someone who may have had an aortic aneurysm in the past. So it's going to be weak, and it could cause it to attempt to vasodilate and could result in another aneurysm potentially. Advanced arteriosclerosis, again, it's the flexibility of the arteries. Apoplectic tendencies, so someone who has a tendency to be angry or flashpoint really quickly, rage, very hot treatments are probably not a good idea. And then someone who has aortic stenosis or narrowing of the aorta. So treatment recommendations for people here: don't use percussion. That is, it could be water that's sprayed on, or it could be a hand-based percussion, kind of like drumming on the skin lightly. But use a moderate temperature water. So in hot applications, water should never exceed 102 and 104 in these types of individuals, and especially insulin-dependent diabetics, because they often have neuropathy, which essentially is a deadening of the nerves or a nerve response that is much less, and they don't feel well in their feet, their hands, and they can't sense the temperature, and so they could be burned much more easily. So you should have no heat to a closed space abscess. So an example that would be an appendix that's inside your body, inside the appendix, and it's abscessing. But if it's external, like on the skin, like a boil or a pimple or something like that, then you can use heat on that because it has somewhere to go. An example of an interior space, the appendix, we talked about not using heat. There was a man that I became acquainted with. He was in his 90s, and when I first moved to Western Washington, and just a delightful old guy, met with him, visited him several times in Chandler Square. And he told me a story about, actually he told me that he'd been a fire lookout in the Cascades in his younger days, and he'd written a book called Switchbacks. And so I found the book, or he loaned it to me, and I read it, and it was very interesting. It was very fun. But the thing that stuck with me all these years is the fact that one year he went up to the fire lookout, and he'd ridden the mule up at the pack train and had all the supplies there, and the mule train had headed back down the mountain. It was already out of communication range, and his side started hurting, and he communicated by radio because they had wire telegraph to the bottom, but couldn't communicate with the mule train, and it was ascertained that he had appendicitis. So the mule train had just left. He's up on his fire lookout for the summer, for supplies for the summer, and he's got appendicitis. What do you do? Well, what he was told to do was to check and see if there was a snowfield nearby, and there was. The snow hadn't all melted yet, but they packed the area on the side where the pain was with ice, with snow. So he did, and he kept snow on it as long as the snow was there. And when it, was no longer there, his pain has subsided, and he went the rest of the summer without having to come down. And when he came out at the end of the summer, he had his appendix out. But it didn't flare up, and it kept it down. And so it's really quite an amazing story about how the power of water and ice and cold to mitigate that disaster in his case. Even if he'd been able to get on the mule train and gone down, it probably would have ruptured on the way with the jouncing and bouncing and the time it would have taken for him to get down. So really kind of an amazing story. So reactions to cold treatments. So people with more adipose and flesh don't immediately react like lean people do. So there's just remember the reaction time is going to be variable between individuals. They can tend to tolerate them longer treatments better because they have a greater warming capacity to their body tissues. Lean people react well but exhaust quickly. So someone who doesn't have a lot of extra tissue, just pay attention that they don't get chilled. Keep them warm, no drafts. So there's a lot of kind of variables to keep in mind when working with different individuals. And people have different skin thicknesses. So people with thick skins can tolerate water temperature differences and water pressure differences better than others. So if someone has a thick skin, they may be able to more easily tolerate percussion from water that is being sprayed on them or poured on them, depending on how the treatment is being done. Just a whole variety of different types of treatments available that can be beneficial for different things. So hot and cold, a little glass of ice water there for the very cold. So Dr. Kellogg wrote a book called Rational Hydrotherapy, and kind of in summary on page 396 of that book, he mentions some precautions. This is a quote from his textbook. When fatigued as a result of the loss of sleep or severe muscular exercise, a cold application should be preceded by a hot immersion bath for 3 to 7 minutes. So basically that point is again saying start a cold application by warming the patient or the individual before doing the cold treatment. Secondly, if but slightly fatigued, the cold friction may be substituted for the cold bath. So we talked about how someone who's exhausted probably or sleep deprived should probably wait. Or if you do use it, he's suggesting using cold friction versus the bath. So cold friction would be a cold towel or maybe some ice in a towel. So it's cold, but not a bath. Third, a very cold bath should always be short. So we talked about the shortness, and should never be administered when the body surface is cold or chilly. The hot bath carried to the point of gentle perspiration is excellent preparation for a cold application. Again, kind of a reiteration of point number 1, where the individual should be warmed prior to doing a cold treatment, or even an alternating series of treatments. Start warm. Fourth, the temperature of the room, air in which the cold bath is to be taken should always be higher or hotter than that of the bath itself. That way, when they get out, they're going to be nice and toasty. And fifth, avoid frequent hot baths at all seasons. So frequent, and especially in winter, as they are depressing and lessen vital resistance to cold and other disturbing influences. The best time for hot or warm bath in cold weather is just before retiring or going to bed. So many, overdoing a hot bath is not helpful for your immune system or for your circulatory system. And those are some precautions that we've kind of talked about in the various scope of things through our talk here today with his book, Rational Hydrotherapy. So this is Dr. Kellogg. Dr. Kellogg was the medical director for the Battle Creek Sanitarium in Battle Creek, Michigan at the ripe age of 24 years old. So he got started young. And then the picture that we see more commonly of him later on in life is on the right, and had a handlebar mustache on through most of his career there. And probably at 24, he almost had to in order to get the respect of the individuals he was working with at that time. I have a friend whose brother was a mechanic, a diesel mechanic in heavy equipment, and whenever he would go out to work on stuff, he just wasn't getting the respect of the guys he was working for. So they suggested he grow a beard, and it made a big difference in his work. Just made him look a little older. and that was enough. So we can this can be reviewed at preparingforthetime.trouble.com, and you can look at others in the series there as well.